Explain Exomind.
Exomind is a breakthrough in mental health care.
I need this, by the way. I have anxiety, I have depression.
We're talking about using a very safe magnet to stimulate the brain, and so it's working on the mind to enhance thinking, cognitive processes, but it's really been the biggest. When I say breakthrough, we're talking about mood disorders. So FDA approved.
Oh, wow.
And that means that most insurances cover it. So here at Miramont, we have contracts so that we can use patients' insurance. Now, if the patient doesn't have insurance, fortunately, we have a special program for folks where they can get value pricing. Because we want everyone to be able to experience it. Even though it's FDA approved primarily for depression, we also can offer it off-label for OCD, different addictions, overeating, for anxiety disorders, and our psychiatric nurse practitioner, Samantha Davis, is really the expert in that area.
TMS, transcranial magnetic stimulation. So it is using magnetic pulses to the area of the brain where emotion, cognitive, and behavioral is at. So you're kind of, I call it, you're rewiring the brain or causing new highways in the brain to help everything work more effectively. The traditional TMS, you have a lot more side effects, headaches, that sort of thing. We're not seeing that with this. People come in, it's painless, it's not cumbersome. They leave right away afterwards and go back to their day. So it's kind of really nice. I think it's a great opportunity to help a lot of people recover from depression, but not only that, also anxiety, focus, overall mental well-being.
Exomind is an outstanding therapeutic option now that is going to give a fast result. So we have an accelerated program that is 6 sessions, and then we have the insurance programming, which is 30 sessions, typically 5 days a week for 6 weeks. And what we're looking to do is to get them to goal with their depression symptoms way faster than people would with cognitive behavioral therapy or even with most medications, and be able to get off those medications.
Sure.
It's that one that has been on multiple medications, or they can't tolerate side effects from medications, and they're just not getting better. I mean, you can layer 3 different medications and they're still coming in and complaining of the severe depression that's taking over their whole entire life, you know, and they're not being productive in home or at work, right? They're the patient we want to come in and talk about with Exomind so that we can improve their life and get them back to living.
Jennifer, you and I share something in common. We both have dealt with depression, anxiety. I hear you've gone through some Exomind treatments, and I would love for you to share with our viewers and me what you felt like before and what did you feel like after the treatments.
Before, I was majorly depressed, didn't have any self-confidence.
Really?
Anxiety, couldn't go into stores by myself.
I've had that same feeling. Supermarkets, hard for me.
Yes.
Wow. So tell me, when you started the treatments, did you start to feel it right away? Talk to me about that.
Yes.
Really?
Within the first week, we noticed a change in my face. No more grumpy face.
No more grumpy face. Your face is beautiful. I love seeing you smile. So tell me about the whole treatment process. Was it painful? Did you go through anything, pain or no?
No pain at all.
Wow.
I feel great.
Really?
I have a lot of self-confidence. No more depression, but we've cut my medicines in half.
Really?
Yes.
And I don't know for you, when I felt less depressed, the sky sort of started to look blue again, the grass green.
You feel like you're walking on air.
Yeah. Did you feel like you were going to see more people, being more social?
Mm-hmm.
Wow.
I think I was more social and people were actually welcoming me this time around.
And do you think you would have done this interview had you done it before Exomind? Would you have felt, no, there's something about you. Well, she's glowing, everyone, and that's a good testament for Exomind.